Hello, Christina.
Hi.
Hello, everyone. Christina and I, of course, are on a split screen today, partly for weather and partly for, recommendations as to what we do as far as mobility. So she's in Victoria and I'm in Duncan on Vancouver Island, Canada. Welcome back to everybody. I know it's been 2 or 3 weeks since we did this last, but are we today, the 26th of January? I can remember because my son is 42 today,
Hmm.
and 42 years ago we had our firstborn. So today, as announced, we're going to talk about traumatic brain injury as well as PTSD. There's a lot of crossover between these two. Um, you can have one without the other, and you can have both. I think the most common thing for a major injury of traumatic brain injury, for example, an explosive device or many things of that type, or a car accident, most often people will have both because it's a huge event precipitating that. So, just to reiterate, I'm, of course, Bill Code with a specialty in anesthesiology and a lot of emphasis the last 24 years on integrative medicine to help control my own MS, and now write books. And one of my subsequent co-authors, as we do our second edition of Solving the Brain Puzzle, is Christina Mitz, who's a nutritionist in her own right and currently studying in the program for functional medicine. So that's a very powerful ally. And of course, her biggest expertise at the moment is microbiome, but that's expanding across the board. And so today we will get some influence also on those topics, which is probably even new to the book. This is chapter 22 that we're talking toward today, but we will cover some newish material within that. Okay?
Mhm.
So I think I'm just going to try outline for people what happens when we have a traumatic brain injury. And traumatic brain injury, or TBI, has become kind of the favorite words, but many people are still clinging to the older term of concussions, repeated concussions. Primary concussion, that just means your first one. Secondary concussion means it's more than one, and down on the road. I think concussion as a term used to mean there was a brief loss of consciousness. Some people expanded that when you so-called saw stars, and that, changed things for you. And others, it had to be almost admitted to hospital or seen by a physician before it was a concussion. Traumatic brain injury can happen with a much smaller injury. So it may pass us by, but the best clue that you've had a traumatic brain injury is huge onset of fatigue plus or minus headache. Okay? But the fatigue is curious because it's the brain kind of shutting itself down so it can get a healing time. And, I've got a chapter in my book talking about this part of the brain that controls things and closes things down. But if someone gets injured, for example, in a game of hockey or a game of football or a game of rugby, it's wrong to send them back into the game if they feel tired, because that is a very major clue that you've got a problem. So the the brain inside the closed box, of course, the skull, is a lot like a bowl full of jelly. But running through that bowl full of jelly is all these miniature vessels, microvasculature, 5 to 100 microns. So very tiny. Okay, remember red blood cells only 7 microns. And when you get that coup contra coup injury, meaning the bowl full of jelly hits one side of the skull and then it bounces back, which is normal to do, so-called contra coup, to the other side, there's huge tearing of some of these tiny vessels. When they tear, two things happen. First of all, they bleed, of course, and anytime red blood cells or blood is outside the blood vessel, the iron in it is hugely injuring and triggers the free radicals uh, dramatically. The other thing that happens when we occur with this there's a huge outpouring of the excitatory amino acid called glutamate. And it sort of starts the ball going, 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 so that there isn't any ability to recover. So we need to somehow slow this down. The other thing, of course, and I'm sure you can figure this out, when you tear those blood vessels, they can no longer carry fresh blood from the heart to that region of the brain. All of a sudden, that region of the brain gets less flow, dramatically less oxygen, and you have hypoxia. The hypoxia is the huge follow-up trigger to ongoing injury. Because the number one trigger of inflammation in the body is hypoxia. And now you've got an acute onset of hypoxia, almost like holding your breath or being choked. Okay? It's maybe specific to a part of the body within the brain, because that's what's injured, but it has a lot of parallels to being choked or stop breathing or drowning. And I think some of us tend to forget this, but that's why oxygen is so critical. And just because you put a pulse oximeter on my fingertip and it reads pretty good, 97, 98%, it doesn't tell you anything of what's happening to that specific region of the brain which has been injured. And that's why I get incensed when people say, well, they don't need extra oxygen because their pulse oximeter is fine. Completely incorrect. The same happens in the heart when you're having a heart attack. You need extra oxygen to reduce the damage. I sound passionate about that, don't I? So that is kind of the scenario of what happens with traumatic brain injury. And I think let's talk a little bit more about that, but the acute way to reverse it is more oxygen. In a perfect world, you'd go right into a hyperbaric chamber. Okay? Well, most of us don't live beside one or near one, but you hopefully, if you're into major sports, most major sports, they've got oxygen on the sidelines. I've been seeing it for years. Somebody will run 100 yards down the football field, or they'll go up and down the ice hockey rink several times, and they're totally out of breath and relatively out of oxygen. So they'll be puffing on, the oxygen non-rebreathing mask. So this is a mask that fits fairly well on the face, and it's got a plastic bag type thing on the bottom. And that allows almost 70% oxygen to go into the body, which increases the circulating oxygen 4 to 5 times. So that's the acute treatment. The longer they're out or unconscious, the longer they need that extra oxygen. I would have no qualms about using it for a day or two. If people want to be super anxious about hyperoxia injury, fine. Use it 6 hours at least, start up, and then use it for 2 hours every 3. But you're not going to have significant injury, and it's going to make a huge difference to the recovery of the brain for traumatic brain injury and stroke, for that matter. So, of course, we know that changes in the body in one part affects another part. So maybe you could suggest a little bit about what happens if we injure part of the brain. What's the secondary effect in the microbiome, which of course is everywhere. I always point to the gut and the gut-brain axis, but what happens in the microbiome if a piece of the brain is injured?
So there is a bidirectional impact there. So if you start out having a dysbiotic or imbalanced gut microbiome, you are more likely to experience a worsened, the effects of the brain trauma are going to be worse. And then, of course, the brain trauma is going to impact the gut microbiome as well. One thing I've noticed a lot with the brain trauma and PTSD clients is they have their HPA axis, or the hypothalamic pituitary axis, it can be flipped. And so their circadian rhythm is also flipped, which also impacts the gut microbiome. And so ultimately, you end up having to work on all of these things to try and bring it back together.
Mm-hmm.
I was actually going to ask you, so I think some people think that maybe concussion or brain trauma is like a casual thing, but it's really, really not. And it can impact your life so heavily. In your book, I think you even compared it to cerebral palsy. And so I was wondering if you could expand on that.
Well, cerebral palsy is an injury to the brain. It's almost always due to hypoxia at the time of birth, just prior to birth or just after birth. And as a consequence, you get that part of the brain quite injured. It's not a full blown stroke per se, but it's perhaps more global than that. And some areas will be particularly affected. And, of course, many of us are used to the early pictures of cerebral palsy, but in its most severe state, it does mimic global ischemia or lack of blood flow, or again, that choking entity happening, because it's got the same tough problems for the brain, because we haven't stated it today, but the brain is only 2% of the body mass, but needs 20% of the oxygen that we breathe in. So it's very critical for the optimal function of neurons, glial cells, all the cells within the brain, that they get this extra oxygen. If they don't get enough, they don't function optimally. And that's why we go awry. And I have seen, and I talk about it in the book, cerebral palsy, Claudine Lenoir's sons, but they dramatically improved once they started getting extra oxygen. Even 1 to 3 to 4 years later, after your pediatrician said, there's nothing more can be done. So I want people to take to heart. If a neurologist is talking about your brain, or maybe a neurosurgeon, and they're saying no more can be done, I almost always disagree. No more can be done in the patterns that they're used to. Fair enough. We all have our patterns of practice, and what we believe is dogma. But what I would like to focus on is having people shift that to look at what else might be done, particularly if it isn't harmful. And I will suggest things, even if they seem a bit unusual for that entity, it is certainly possible, and anything in the brain almost, hypoxia, lack of oxygen is a big part of that. Now, the other part, that I've learned, and you talked about the bidirectional flow, the vagus nerve. The vagus nerve, of course, we used to think went from the brain to the heart to the gut and all these areas. It's the one we talk about when people are vomiting or nauseated. It's the vagus nerve. Or when the pulse goes down really slow. And this is particularly a problem in children in anesthesia, for example, because many things trigger that super slow. And children are challenged hugely if you slow down the heart rate. Because if you need to increase the heart output, the only way you can do it in a child is increase the heart rate. Because you can't fill any more volume of blood within the heart because it's fairly small and it beats faster. But if it isn't beating faster, you may not get enough blood flow for oxygen care of the heart and the brain, which are, the two primary oxygen requiring organs. There's many other important ones too, but they're the ones top of our mind all the time. So we also know that if we get that injury to the gut, for example, so maybe they have a relative stroke to the gut. So now you've shut down blood flow. So now many things are injured dramatically. Maybe not right away the microbiome, because most of the microbiome is anaerobic, doesn't need any oxygen. Okay? But the point that really matters is the good blood flow in the lining of the blood of the gut where our absorption occurs.
Mm-hmm.
And that's where a group of cells we don't want to injure, and we don't want to injure their interaction with healthy symbiotic, team player bacteria,
Mm-hmm.
I guess is the main one.
So if someone has had a concussion and they haven't done anything about it and it's years later, can they still go and try some of like some oxygen or some other treatments? And
They can. We've had people 15 and 18 years later do a large amount of recovery. It's really exciting.
mm-hmm.
And, often they've given up long since hope. But if you get the story and it's practical and it's possible there's traumatic brain injury, because a lot of people have pushed it aside. I even worry about the headers in soccer. And anybody that tells me that they played contact sports like rugby, football, uh, hockey, field hockey, polo, falling off a horse is one of the main injuries to the brain, traumatic brain injury in women, because they horseback ride more and you can fall off, even with a helmet on. A helmet helps some. And I'm a big fan of helmets. I wear a helmet every time I cycle. Fair enough. But it doesn't do everything. It's a start. It's a great start. But it doesn't guarantee zero injury, I think, as we know. Yeah.
Right. So we've talked about oxygen. What about the laser therapy for?
So laser or photobiomodulation, its old name was low-level laser therapy, or cool laser, some people like to use. Now there's people calling it red light therapy. And that's a shortcut because many of these beams that we think about and talk about are in the red spectrum. Okay?
Mm-hmm.
So it's increasingly being accepted. So the helmet looks like a bicycle helmet. I've showed it to you before. Anyway, it is now approved by the US FDA as being useful for traumatic brain injury and post-traumatic stress syndrome. Okay? So we know that it works partly by improving the function of the mitochondria, so the energy-making parts of the cell. It seems to also improve their ability to use oxygen to make energy. Okay? And in the chronically injured or a problem within the cell, and I'm thinking primarily now about the neuron, okay, because it's the most energy requiring cell in the body, probably, rivaled closely maybe by the heart cells. But it's a function there of the nitric oxide is so tightly bound to some of the proteins within the mitochondria that the oxygen can't attach. And the laser therapy, or the beam of light that gets in partway from the light emitting diodes of the helmet, is able to unlock that nitric oxide. Now, nitric oxide, when it's in the right place at the right time, incredibly important. A brilliant vasodilator, makes the vessels bigger. But as it moves away, allows the oxygen to move in and work better. At the same time, the laser beam downregulates or reduces the inflammation. Inflammation is never our friend. Remember, one of the big triggers for inflammation is hypoxia. But the other thing about inflammation causes swelling. And remember, we're all about blood vessels and blood flow. But if you reduce that, swelling happens in the walls of the vessels, and now it's reduced by half. Flow has gone down to 1/16. Okay, so those are really important features to remember. Anything, and the laser is one of those pieces that will reverse that whole process. And we have seen now, I just spent time yesterday talking with Josh Crawford, who is the owner of the local Genoa Laser Therapy. And I talk a little bit about it in the book. And as we do the revision, we'll be talking about it, a bit more about it in the helmet we'll be showing. But they have used the laser now on over 30,000 incident treatments. Okay, so that's pretty impressive over 6 years, but they're starting to really be dramatic what they can see and do with it. And they have had traumatic brain injury patients months and even years and even more than a decade later. Within a week of the helmet, they're starting to get more of their own being back. their
Mm.
own degree of wellness. Okay? Some of them are smiling, interacting in a joking fashion for the first time in years. With as few as 5 or 6 treatments, of course, often you'd be better to do at least probably a couple of weeks and then maybe some maintenance. But all those things apart, it's probably the newest kid on the block to really make a difference in helping reverse that process. It's a credible synergy with extra oxygen. Okay? And so
Mhm.
often when they're doing it, they've got the person on some supplemental oxygen by one means or another, depending which unit they're using, with an oxygen concentrator. And as I've talked about before, anybody with traumatic brain injury or even PTSD, I would encourage you, get your own oxygen concentrator so that you can do it at home. You get a new injury, you should use it. Everybody should have that opportunity if you're going to be in a competitive sport that's a contact injury sport, because it can make such a difference. And the earlier it's used, the better. However, don't give up hope, because those cells that are shut down for lack of oxygen can turn on again when they get oxygen and energy because the mitochondria are working. Yeah.
Hmm.
So the laser is a good question. The other thing that sometimes can help, because traumatic brain injury people often, they've got bouts of anger, you know, inability to concentrate, as well as sometimes inability to tolerate noises or sounds around them. And
Hmm.
curiously, one of the things we know is happening within a traumatic brain injury, there's a huge outpouring of some of the endocannabinoids. So some cases will be dramatically improved, especially with CBD, but components of medical cannabis.
Hmm.
So it sometimes has a place in the mix to help settle down. It may allow them to interact with their children again, and they couldn't because of their injury that they'd sustained, maybe overseas, uh, in a war zone, or maybe it's just been in repetitive injuries in their sport. Yeah,
Hmm.
so that goes in the mix. And then again, you said it, and I kind of went past it. I shouldn't have. If people have a very healthy gut in the first place, they will tolerate and recover from injury much better.
Mhm.
Okay? Because they're not behind or dysbiosis ahead of time, because the body always works as a team. And if we have one of those teams players at half strength, or maybe he's on holiday, everybody else isn't going to, recover as well when you have an insult or a challenge.
Mhm. Yeah, one phrase that really stuck out to me in the research that I was looking at was that those with PTSD have an exaggerated inflammation response.
Yeah, so let's talk about PTSD. So post-traumatic stress syndrome. So I liken it in the book a lot to chronic pain. Okay?
Mhm.
Chronic pain we know happens. So one of the classic ways to talk about chronic pain is shingles. People will get, a chickenpox-like illness. It is chickenpox. It's the same virus. And they'll get vesicles, little blisters on one side. And I'm pointing to the face because that's one of the places they occur. The classic one is right at the chest, right at the breast or nipple line. But that is quite severe recurring pain. And when that happens continually over several days, the body develops what we call wind up. So the message goes so often from the painful part of the face to the brain, it almost becomes a continuous reflex arc. So now, even though the face heals up, you've still got the severe pain. So if we take that over to a bit of the corollary or a bit of the equivalent happening in PTSD. So say you have a car accident or repeated car accidents or repeated beatings, for example. Each of those tend to burn a pathway. And it seems the more huge or dramatic or absolutely frightening the component is, it can burn a pathway in one go. And that's why people, after a single rape, worse after multiple, of course, but after a single rape, can have tremendous PTSD or a terrible, frightening experience. And some of us are more prone to do it than others. Maybe it's what's our individual makeup, and where is the backup happening for, recovery? Because if we don't have good backup systems to adapt and recover, then all of a sudden we're more at risk. So PTSD, post-traumatic stress disorder, has curiously some of the same issues within it as happens in traumatic brain injury. You get that huge release of glutamate and other features, and you can get secondary inflammation. And that's probably part of what you read about when you were talking about the microbiome.
Well, I was reading about decreased Treg cells. I was reading about, I guess the microbes that would play into that glutamate balance as well. So if you have high glutamate, you're going to want to balance it out with GABA and increase the microbes that do that. And then there were differences between the different groups with PTSD. So for example, veterans had a different microbiome signature than the other groups. So veterans were more likely to have high E. coli than the other groups, which I imagine is because they've been overseas and drinking mystery water or something.
Well, mystery water, but also, I don't think it's a great varied diet that you get. Certainly when you're going to do dried out rations for days on end, but there's a lot of sameness to it. I mean, the Army and the Air Force and the Navy are not unlike any other institution, like hospitals or poor quality hotels or whatever. They don't have that variety in the diet. And we know that variety in the diet is really incredibly important for the health of the microbiome. So they're used to not having it. They adapt, their gut adapts, but it loses that resilience. And the loss of resilience makes them more prone to the problem of inflammation. You get an injury or an insult, doesn't have to be hypoxia, but it might be. It doesn't have to be a blast injury, maybe some huge frightening experience, so you can't be resilient and recover as well as would be optimal. So you're more ill as a result of it, and you've got probably a tougher journey to get all those pieces working again. And in some of us, of course, that huge frightening episode, or whatever the episode is the straw that breaks the camel's back, because we were just kind of getting along, and now we have some major new injury, and getting back to normal, so-called normal where we were, is very tough, because now you're down here just from that one injury, because everything went off the rails. The great balance or the great homeostasis of the body totally messed up. You don't have the reserves to get it back to normal. So you've got to work extra hard at your diet, your exercise, reducing your toxins, and all these other pieces, when you thought, well, if I just get better from the problem, I'm good. It doesn't work that way. As all of us with chronic illness know, it's not that simple most of the time.
We do have a couple questions.
Sure.
Have a look at those.
Yeah,
Lee says, in 2006, I was in a coma for 4 months. I am recovering thanks to your help. Thank you so much.
Well, sure, because while you're doing the work, if we're helping you, then you're doing what we recommend. And if there's anything we do in solving the brain puzzle and in the work that Christina and I do, it's to coach you, teach you, empower you to do the steps to get better. Sure, and some of it's great if you can use the jump start. And my old jump starts are oxygen, laser, and enhanced microbiome. Because you can always sometimes get great strides forward, but you still may need to do the other subtleties. Yeah.
Mhm.
So thank you for that.
Irene asks, can you get shingles more than once?
Yes, you can. It's recognized now, and so most of you have experience with cold sores or, herpes simplex ulcers on the lip, okay? Or sometimes genital. We know that the herpes virus lingers on and lives within our body, lives within our nerves, for example, okay? And when your immune system, typically, when your immune system is down or depressed, all of a sudden they flare up, okay? Or if you're working super hard and you've been just getting by on adrenaline and cortisol of your own body's making, eventually things crash. And so they turn up. And my favorite thing to minimize those is zinc. And that's why zinc is one of my favorite things in a time of COVID, which is another virus. But yes, you can get recurrence of shingles. I wouldn't rush out and get the vaccine. I haven't had the vaccine. It's been offered to me as recently as yesterday. But I'm not keen on the shingles vaccine. I don't think it does near as well. Almost all of us, my age group, I'm 67, have had chickenpox at some time in our life, and we are at risk of shingles. But the best way is to stay really healthy with a really healthy microbiome and solve the problem. But in the short term, make sure your vitamin D is adequate. And to me, that's in the 125 millimoles range, okay? Which would be about at least 50 in the United States, okay? In that range. The vitamin D will help, the zinc will help, and general microbiome health will help.
Mhm.
That,
I
and
dose
you can
nutrients
allude to that
too,
if you want. What's that?
like nutrient dense. So I had a friend who had shingles a couple months ago, and I knew that I could only recommend a couple things because it would be hard to make this person do a lot. And
Yeah,
so
yeah.
basically it was vitamin D, zinc, and then ancestral supplements. They have like these organ supplements. So you're basically taking liver and spleen and thymus and heart all in a supplement. And so it was really only a couple of weeks and then he was better.
Well, that's right. And there's no question that those things that are made from meat materials or organ meats are higher and more dense. Not
Mm-hmm.
everybody can access it. Not everybody will access it. I mean, you get a major vegan into you, they're not going to take that choice. Okay, so you
Mm-hmm.
have to find other ways to work with it. The secret is to find ways to work and help that individual that fit within their own personal belief system.
Mm-hmm.
Um, Sometimes you have to try and get them compromise some in that, but it's going to be tricky. So better if you can adapt your degree of wisdom to something that works for them that they can deal with.
Mm-hmm. We have another question. Where to get an oxygen concentrator? What is the best brand?
Well, I think there's a lot of good brands out there. The favorite one that I have is a Philips. Um, they've got another name, but in Canada, a really good place to go, and this sounds very Canadian, is CanadaA.com.
I thought it was Sleep A.
I'm sorry, SleepA.com. I was thinking of the Canada part too early. So it's .ca, I think, isn't it? Anyway,
Mm-hmm.
sleep and sleep apnea and problems with your oxygen during sleep is probably why they picked that number. They've used EH or A at the back of sleep because that's the Canadianism. They can always tell when we're in America or in Australia or in Britain. When we say A, did you get that? We do it by reflex almost.
Yeah.
I mean, I sat down in a restaurant in Chicago a lot of years ago. We were ordering soft shell crab with my sister and brother-in-law, and I had just ordered, and he said, "What part of Canada are you from?" The waiter. So I did it myself. I get that, and you do it so long, you do it over decades that eventually you don't even know you're doing it. It's just part of your vernacular speech.
Yeah.
So you learn the hard way. But anyway, sleepa.ca, and they are very good. There is some centers, and if you want to email us, you may be able to find that, or eventually we may put some links on the website. So drbillcode.com, DRBILLCODE.com. You can find a link to my website at Christina's website, mindmoodmicrobes.com. All right. So you can do the link back and forth. And if you are interested, that's of course where you can send your friends if they're not on the Facebook Live today or you want to follow up on this. Just go to drbillcode.com under blog and you can find today's program listed. It'll also be in a YouTube type video so you could download it theoretically. And at the same time, you would have the option of listening to it audio because one of our colleagues helps us put it on an audio podcast. And then you can listen to it in your car, so to speak, and still safely drive. Yeah.
Right. So if you are trying to recover back to brain trauma and PTSD, if you're trying to recover from these things, are you going to be able to recover if you are still drinking alcohol or eating a diet high in gluten and dairy?
Okay. So we're back to trying to get the synergy to get the whole organism better. Okay. One of the problems we recognize with both PTSD as well as TBI is that there's an increased amount of inflammation somewhere in the body. Okay. Typically it's in the brain, a region of the brain, maybe the whole brain. That excess inflammation is a big factor and we really want to down-regulate it. So we start talking about what would reduce the amount of inflammation in the body. So part of it's diet, a nasty way to boost inflammation in the body, unfortunately, is gluten and dairy. Okay. It's a huge factor. So you may need to do that for 3 months in the scheme of things. Another major regulator of inflammation in the body and reducing toxins is the intake of glyphosate. So at least for that time, you better eat organic potatoes, organic sugar, organic wheat. Of course, you're hopefully already off that. And bring down that amount of glyphosate or Roundup that you're taking in the body and all the GMOs that they put them onto, corn, canola, soybean, because each of those features injure the liver, so it can't break down drugs or toxins. And we all take in some toxins, that's only normal. But if you really hamper the liver by poisoning it with those entities, it makes a difference. And of course, it's very hard on the microbiome. It works as an antibiotic. So there's a few really tough resistant organisms like Salmonella and C. difficile and one or two others, and they get very dominant because you don't have the diversity of healthy other bacteria to keep them in control or in check. They won't be a problem, but if you let them become very dominant, they can create a problem. And it's fairly major. So by bringing down the inflammation across the board and reducing the toxins, your body, if it's not working hard to get rid of the toxins that you breathe, drink, or eat, it's got less work to do and can spend more time on healing and regaining your personal homeostasis. That covers part of it. Did I miss some stuff?
Yep, that covers it generally. Some of the other things that I liked when I was looking into the microbiome, PTSD, and brain trauma research was, they were saying we can manipulate these mechanisms with the microbiome and with certain food and herbal items to accomplish like the result of bringing down the inflammation or lessening the symptoms related to brain trauma and PTSD. And so if you want to be sciencey about it, they were talking about histone deacetylase inhibitors which some of those compounds that accomplish that come from microbes. And so they were referencing specific microbes like streptomyces, and then certain herbs and items that would increase certain short chain fatty acids like butyrate. And so one of the ones mentioned was grapeseed as being pretty helpful.
Yeah. The hardest part, I mean, it's really important that you and I try and collate the material that's out there because, we're not at it at the research lab level because the biochemist will have great nuances of information in those detailed areas, whereas ordinary clinicians won't have that. Okay.
Right.
And the lay public have it even less. So we try to get it into a language or at least a component where they can work on it. And so rather than name the individual things to people,
the histone deacetylase inhibitors,
such as histone D, we instead talk about cytokines. That just means a part of the cell. It's a molecular entity, and those in a group can have positive or anti-inflammatory benefits or negative, meaning pro-inflammatory. Probably use those hands backwards to illustrate a point. But anytime you reduce the pro-inflammatory problems, you're winning, okay? And unfortunately, drugs haven't worked very well for that for us. I mean, we know of anti-inflammatories, but almost all of them have a major cost within the body and actually slow healing. So I try to avoid ibuprofen now and naproxen and aspirin and all these things because they've got a tough cost-benefit ratio. Their cost is even higher than the benefits might be. The same with prednisone. Prednisone is the last hammer we use if someone's, can't breathe and they've got terrible problems with their airways. Fine, we will bring in prednisone as a last resort. But we know it's got some very tough side effects and it won't continue to work forever. So we've got to solve some other problems. It might be initially life-saving, but it isn't a long-term answer for us. Same as long-term people on prednisone or one of the other steroids, it's a relative disaster. Your bones disappear, your skin tissue disappears, and you have gastrointestinal bleeds or bleeds in the brain, and it's just a tough downhill battle. It's shortcut, short term, but try to look at it only as that. Yeah.
Sandra is asking, what do you think about the Viome gut intelligence testing?
Well, you've done a lot more testing on the gut. Why don't you talk about some of your favorites? Because you just, sent me a replacement chapter talking about that.
So I have used Viome, and they're really good for identifying each and every microbe that's in the large intestine. They even include some viruses, and they talk about which metabolic pathways the microbes are related to, which is cool. But then they give you these recommendations that are based on the microbes you have and not on what you necessarily need to grow. So for most people who live in North America, we're missing a lot of microbes, and we need to change our diet or our lifestyle or supplements in order to grow the ones that we need. And so I don't like the recommendations that Viome gives you along with their testing, because they're basically saying, well, here are the microbes that you have, so just stick to like this group of foods that these microbes do best with, instead of trying new things and trying to grow the new microbes.
Yeah, and that's, individual variation is an important piece in this. What is your own individual makeup? And the diversity in your microbiome might be considerably different than mine. Okay, and yet we might still achieve optimal health. So I try and focus partly on generalities, as you have, and we've talked, and we will talk again about fecal microbial transplant or other variations, but we try and really focus on the pieces that will improve our own entity, our own diversity. So there is one of the ones that you're a bit more keen on, isn't there, for testing?
Yeah, my favorite is BiomeSight, BiomeSight. And they test for bacteria only. So they don't pick up the viruses or the fungi or anything like that. Instead, if I'm looking for fungi, I'll use the organic acids test. But for bacteria, I definitely like BiomeSite the best. It allows me to look at things from multiple angles, including, well, what toxins are being produced, what neurotransmitters are being produced, what pathogens are there, what commensals and probiotics aren't there. So, and they also don't list you recommendations. They get you to get the recommendations through someone who's trained properly in microbiome restoration. So you're not gonna, it's not gonna be the same as Viome, where you get this PDF and it's like, eat this because you have these microbes.
Well, and I guess one of my suggestions is this maybe isn't something you want to do at home on your own, because it's daunting. You get pages and pages and pages. Most of these things you won't even heard of.
Mm-hmm.
I mean, it might have a little section on E. coli, which we've heard of. It might have something on lactobacillus or bifidus that we've heard of. But most things, they're way out of our territory. In fact, this field is moving so fast. Every 2 or 3 years, some of these have a new name because they've christened them something else because of another reason, or as they've come to understand them more. So it's in its relative infancy. It's about as easy to work out, I would suggest, as getting your 23andMe and getting all your gene report back. It's daunting. In fact, it's a waste of time until you get somebody to interpret it for you that really knows what they're up to. I'm not saying that that's the be all and end all, but many of us have done it because it was relatively inexpensive. But it's just as challenging. But the other important part in that mix is because we're naming the bacteria, just as we're in, checking the genes, we're naming the genes, or we're naming the subset that you have. But that is only a small portion of what our interaction with those bacteria or the genes are. And in genes, we call it epigenetics. So you have a tremendous ability. The number one I used to talk about was vitamin D. It'll turn on up to 2,000 genes, turn on the good ones, turn off the not so good ones. Extra oxygen, up to 8,000 genes it can make a difference on. And we're just at the early nuances, recognizing that the microbiome is a huge piece of our genetics. It may be as high as 99%. But let's just leave it at 90. Okay? So if it's 90%, just naming the particular bacteria, even if you've got a few fungi and viruses thrown in, we don't have the responses that we can create with them by the better teamwork and diversity, which to me are like epigenetics. It's turning some bacteria on, some off, or affecting what they produce or do. Because sometimes they're your major friend, turning T4 into T3, a quarter to a third happens in the gut. So your thyroid is working optimally. Okay, well, that's a big asset. Or reducing the toxins, whether it's heavy metals or herbicides, pesticides. It's the other part that's trying to help that. So we're still in an infancy saying this is the best microbiome because we don't know that. And we certainly don't know that for you in your current personal environment or situation. So these are to be dealt with as another clue, but they're just not the be all and end all that people try to make them into.
I agree. Yeah.
So we have to work toward that one. So we've got another question from Shelley, and it's a very good question, actually. Would a pulse oximeter be a useful tool in helping brain injury recovery? Well, if you're going to get a pulse oximeter to try and help your brain injury recovery, spend a few extra dollars and get one that goes on the earlobe. The earlobe is a much better suggestion of what the pulse oximetry is in the brain than is your fingertip. Now, I'm very big on pulse oximeters. I did some taping the other day talking about pulse oximeters. Everybody should have one at home these days, because if you get COVID, you can really learn how well you might stay out of hospital by having a pulse oximeter. And they did it for that very reason in Ireland. The medical people did that. They did it some on Vancouver Island. If people went to the emergency room and had some COVID symptoms, sometimes they were sent home with a pulse oximeter, and they would find out every maybe twice a day what it was, and if it started to go awry, they went to hospital. I think pulse oximeter is a great idea. You won't be able to follow the final nuances of how you're doing in your brain by fingertip pulse oximetry. You'd be much better off with something on the earlobe. And those are a little harder to find because they're a different probe and they're a little bit more expensive. The others are down to $40 or $60 now just because of the huge masses that they're producing. Because many people will have one. And I think it's one of the best things you could have. It's probably as useful to have at home as a hypertension measurement blood pressure device for the simple reason, if you're going to have hypertension, you want to know what it is at home. Okay? You don't care what it is when your doctor's got their white coat on. Well, you care some maybe, but it's not as good an indicator. But home information, learning more about your well-being, because a lot of things will affect the pulse oximeter and the fingertip. I mean, you don't want to have a lung problem so severe that your pulse oximeter is bad here. It's, of course, bad for your brain, too. All right? Most people, if they're young people and their lungs and heart are all working well, and they're in the 98 percentile, or 98% on their pulse oximeter, well and good. But that doesn't tell you what that injured part of the brain is doing. Okay? So if you're going to go that route, get one for the ear, the earlobe. We use those. We use them in anesthesia. I've got them as well because they can be indicative and helpful to try to determine if you've got a patent foramen valley. That's why.
Excellent. I think one thing we haven't really covered yet is the circadian rhythm piece. I've had a couple people really close to me who experienced PTSD and or brain trauma simultaneously. And they always seem to have these flipped circadian rhythms. And so now when I see people with that, I do try to at least gently shift that circadian rhythm. So whether it's by like as soon as they can wake up in the morning, because a lot of the time they end up sleeping more, but as soon as you get up in the morning, try to expose yourself to some sort of natural light, or if you have like one of those vitamin D lamps. And then in the evening, put on your blue light blocking glasses and use the screen blocker if you're working on your computer or watching TV. And then have a really calming bedtime routine where you maybe read a book or do a meditation or listen to some music or something like that to help you fall asleep more easily at nighttime.
So circadian rhythm is very critical for us. We know from years and years of measurement, the people that work shift work have the poorest quality health and the most chronic health problems. And that's because of lack of sleep at the optimum time of day for those people. They don't have any choice, unfortunately. It's how they're employed. And, God help you if you're a doctor or nurse or whatever, you're going to lose some sleep. And it's going to mess it up for several days. Or nobody's going in an airplane hardly at all now. But if you go a long ways in jet lag and time zones, then it's always messed up. Mm-hmm. Everything you can do to help reestablish the normalcy of the issue. Because the body takes cues from outside. There's a very interesting thing. People, if they happen to be up, love dawn and they love sunsets. Because there's a window there, maybe 15 minutes, maybe 20, okay, where we're getting the red and infrared and far infrared features in the eyes and therefore in the brain to the third eye, the pineal gland, which is part of what's setting our circadian rhythm. And we're getting that closer to normal, okay? So it optimizes function within the brain, and it's a piece of the circadian rhythm. So that's why it's exquisitely important. So if you can haul yourself out of bed for the dawn, take some time off to watch the sunset, great. If it's super cloudy, it's not quite as effective, but you can mimic it different ways. You can use blue light in the morning to help wake up.
Mhm.
Seasonal affective disorder lamps. They can be quite helpful in the morning. Don't use them after lunch. For sure, don't use them after dinner or supper, okay? Because it's going to be wakeful. The same as screen time. Screen time is one thing waking up because it's almost all blue light, even if you, although you can set it a little better. But after evening, you should start to stay away from those. Or, I mean, I can now put these on. So they're yellow primarily, but they're blue blockers. They effectively block the blue light. They actually increase contrast. I can see the golf ball better further away in the detail. I can ride my bike in the dark, and I can see a better issue where the holes are. But all of these are clues, but they're incredibly useful to maximize those healing pieces within us and reestablish the circadian rhythm. I don't tend to lean on drugs very often, but I sometimes will use cannabis to reestablish that nighttime sleep component so that people are trying to get back to more of what the normal clock is, and try to use the light piece, use total darkness, because each of these help that scenario. Part of it is melatonin formation, which creeps up through the night. But as soon as you have light, even on a hand, shuts it off. Okay? So you're destroying your circadian rhythm by things that you do, and you can usually control. And the other one that messes up circadian rhythm, but nobody gives it enough time and energy, is the problem with EMF, electromagnetic forces, electromagnetic radiation, from your cell phone, from your Wi-Fi, and all these pieces. And we avoid those of us that have an injured brain. So traumatic brain injury, PTSD. We have to pay much more attention to these nuances than someone who's healthy and well. Sure, they can make jokes about you. It's a big deal. I mean, I'm over it now. They can make jokes about me all day, but I do a lot better because I have a, relatively non-optimal brain from the MS. So it's worth it to pay nuances to the detail. And, it's good that you're really focusing, helping those people normal back. You've got to creep back to normal. You can't jump back to normal. I wish, but you can't.
Well, we've got 4 minutes left, and I feel like we've pretty well covered everything.
Well, we have one thing I didn't do probably is there's increased data now about PTSD. And it seems to be shutting down. Ordinarily, we'll have a fear. We'll see a tiger's gone, good. We can get back to normal. But in those of us with PTSD, we see the tiger or some very frightening, fearful event, and we're not able to turn the fear off. That's kind of what's happening in the other. And so it's kind of set on overdrive. We'd like to run away or whatever we would like to do, or it's terribly frightening, and anything can cause a flashback to it. I don't know if a kitten can trigger the tiger fear, but most of us know some of these images that might just take us right back, or the sounds that might take us right back to that terrible event. And so it's as we learn more to understand that, but I guess the best way to generalize it, kind of as a way of ending, is we're trying to reestablish resilience. When we're optimally healthy, not just not sick, that's not the same as healthy. Optimally healthy means you've got all that resilience ways to get there. And it's a journey. I'm still working on it myself. I learned from my colleague Alea the other day. I'm going to start to look at some of the Indian practices of additional components of breathing and work, finding other methods for that optimal health, beyond the regular mindfulness and breathing techniques 4-7-8 that I talk about. But we've got to find the pieces in the journey. Even yoga is getting hard to do because of all the restrictions or whatever. So it's a journey.
That does remind me, there are so many brain retraining programs as well. And within the functional medicine community, there were a couple of programs that came up as being recommended for PTSD. I don't remember them off the top of my head, but
Well, no, and you've got to go with what's in your local community,
mm-hmm.
and you've got to go with what you can afford, and you've got to go with what works for you.
Mm-hmm.
If you tried and it starts to work for you, and you've got someone helping you work through it, fantastic. If you don't have something that works for you, move on, try something else. You will find some pieces.
Mm-hmm.
But with, new information now, I would really encourage people to think about the helmet. You can purchase your own for about 3,000 US, genoalasertherapy.com.
Mm-hmm.
It could be a great technique, oxygen concentrator at the time of, even better. And all of these pieces are starting toward it so that you will need less of the other medications or so on. Yeah.
Mm-hmm.
Okay. Well, that's great. Good day. Once again, folks, please
Mm-hmm.
share this. We will be doing one next week.
Mm-hmm.
We're into February next week. Yeah, there
Yep.
you go. And so we'll look forward to that. And we'll probably be doing one on COVID in the next 2 to 3 weeks, just
Okay.
because there's pieces starting to happen, lots of interest about different topics.
Mm-hmm.
So it's time to maybe refresh some of those buttons. Okay.
Sure.
Have a great evening, everyone. Thank you for joining us. Please share us out if you can. And if you want to do that, go to the blog site at drbillcode.com and search it out. You can find us there for previous ones. This is chapter 22. We've got 14 more. Take care.
Bye for now.